So the most important role for long-term care pharmacy for caregivers and for seniors. Having a trained pharmacist with geriatric-centered training to look at all resident medication and reconcile them. And by reconcile them, I mean review them for unnecessary medication due to duplicate therapies from different doctors, as well as we look for potential allergies between medications. If you're using 2 or 3 more medications, what are some side effects that might be harmful in using those together? As we know, the residents, you could have 3, 4, maybe more doctors all caring for this senior, and they might not know what the other person is prescribing. So having a centered pharmacist with the geriatric training and experience, being able to provide that is definitely one of the roles that we provide to them. We also offer nurse consultants and pharmacist consultants who go out to the facilities and review charts and make recommendations for prescribers as well as the staff on what care they're not seeing, that there might be changes to better care for the residents in the facilities. We also offer educational offerings to the facilities, whether it's nurses or med techs. We do disease state in-services. We do regulatory updates for yearly medical technician certification. We do Alzheimer's care training, CPR training, and that's just a few that we offer as a long-term care pharmacy. We also are available for the staff members in the facility to be contacted 24/7 for support. Long-term care pharmacies must be available to meet the needs of the resident regardless of the hour of day that is necessary. We also have account managers on staff who visit the assisted living facilities on a monthly basis to perform cart audits to make sure what's on the medical records is what's in the cart for each resident. That person also acts as a liaison between the pharmacy and the facility, so if there's any changes in the pharmacy or changes in the facility that need to be communicated rather than relying on a fax or a telephone call, that person is an employee of the pharmacy and can bring all that information back and disseminate it to all the staff members in the pharmacy. We also do deliver the medications at least once a day, but in most cases twice a day to each facility. We deliver the correct medications through our various checks, and we deliver it on time so that residents do not miss a med pass. And also, most long-term care pharmacies collect money on the back end and not at the prescription counter like in a retail setting. So we are not collecting money from the residents for co-pays at the time that we deliver the medication. We actually bundle that as a monthly basis, and we actually deliver that in one invoice at the end of the month. There is risk on collecting this money, but the resident has to receive that medication in that setting. So the long-term care pharmacy absorbs that risk in order to care for the resident and get their medication in a timely manner to them.